Thank you, Dr. Shishir. And we'll have Dr. John now. So, Dr. John has been a mentor for me and for a lot of people. He has been inspiring us with innovation, striving us to do more every time, publish articles and all those things. And name it, and he knows everything about everything actually. So you just text him, and he'll give you 100 texts back with all the information regarding whatever it is what you want to know. And today he's going to give us a talk on smartphone apps. So this is going to actually be a talk of everything. Over to you, Doctor.
Thank you, Dr. Prithvi. So now we have seen how smartphones can be used for eye photography, that is anterior segment, posterior segment, with the slit lamp, without the slit lamp, with adapter, without adapter, doing retinoscopy, doing tissue microscopy of all things. Tissue microscopy with smartphone, I think none of you have seen it before. So you don't need a lab microscope. You can just use your smartphone. You can use your torch, put everything in your pocket. Slit lamp and lab microscope is already in your pocket. Now we are going to the things which smartphones are actually made for, apps. So apps for smart ophthalmologists. So conflict of interest, I do have a lot of apps which I made, but they are all free as of now. So no financial interest as of now. Maybe later. When I started making apps, it was during my school days where I learned C++, QBasic, Logo, Turtle, HTML, JavaScript, and made some games, made some websites. And all these are QR codes. You must have noticed in Dr. Prithvi's and Dr. Shish's presentations, all those QR codes, they link to the articles and videos. So after that, during medical school days, we made the medical website. We did some flash animations. We made a surgically induced astigmatism calculator, all because we needed it. We made a period of gestation calculator because the OG PGs made us sit and calculate all the period of gestation for all the patients. Only then we could go for break. So we made this. From my batch onwards, everybody would finish it quickly and go off for break. And the OG PGs are wondering how we finished it so fast. So then ophthalmology residency days made some apps for ophthalmologists. iGrader, which has all the grading systems in ophthalmology. I know Tamil because when I was in Tamil Nadu, this would help you to communicate with the Tamil patients. Bangla, because we had a lot of Bengali patients also. And 3D Atlas of Ophthalmology because I love 3D. And let's just look at the normal flow of an eye clinic. So we start with history taking, general examination, and so on. What can we do in history taking? During the COVID pandemic, we were thinking of using video calls for history taking. And instead of going through the internet, we could do a direct call from phone to phone, but not required now because COVID pandemic is over for now. Then, of course, the I know Tamil, I know Bangla apps for language translation. Then for general examination, pulse rate can be taken on any phone with the camera because the camera can sense the change in illumination through the flashlight. Again, there was also something for breath counting by checking the movement of the chest. These are all not required for ophthalmologists, but ideally you have to know all these. And you can check pallor, you can check cyanosis, you can check icterus. All these we don't consider at all because we are ophthalmologists. Vision is where we really need an app. So there is something called the iChart Pro, which actually connects an iPad and an iPhone. And it is a visual acuity chart with all the things. And you can control the iPad using the iPhone. I don't think there is a proper one for Android yet. We will make one soon. Then the other one is the Peak Acuity app, in which you use a small smartphone alone. It is only for Android as of now. And you can sit at 3 meters or 2 meters and check the visual acuity by using the e-chart on that. Then stereo acuity, you can use red blue anaglyph glasses, that is 20 rupees or so online. And you can use this NTU RDS screening test app to check the stereopsis. If you want to get the actual stereopsis testing chart, I think it is almost 20,000 rupees or so. You can use this by using an app. Ocular examination, you can do all measurements using an app called Image Meter, in which you have to have something of known size. and you mark that reference marking on the app. Everything else you mark, you can measure automatically, including areas, angles, areas, lengths. Eye position and movements. Eye turn can be used to look at the eye turning. Eye tilt for abnormal head posture, and 9-gaze app for taking 9-gaze photographs. Anterior segment photography, you've already seen the presentations earlier. You can use your smartphone. You can use it either barehanded. You can use it with an adapter. You can use it without a slit lamp by using the intraocular lens. And many people ask, what intraocular lens? It is the one which falls down during your training. So it's the cheapest intraocular lens which fell down during their training in Arvind. When during cataract surgery, they put the lens, somehow the nurse gives you and it falls down. That is the lens which we used. Okay, so it's not some expensive lens. You can get whatever cheapest intraocular lens you want. Any sample lens, you can use a sample lens. You can take good photographs by adjusting the illumination. You can take gonioscopy and you can take fundus photographs. And so this is the IOL scope, the ASP, and of course the IOL scope is also there. I'm not going to go further in those. Then there are apps for toric axis marking. This one, iToric Patwardhan, is very useful. Toric IOL axis marker is also useful. You can mark the dot, and the phone's gyroscope will be able to tell you how much rotated it is. So then on table you can mark it correctly by subtracting that. Then fundus examination. This is the foldable fundoscope which we are talking about. This is the old version. I'll show you a picture of the new version also. Then of course Dr. Prithvi had the Trash to Treasure Red Cam and the Do-It-Yourself Red Cam by Dr. Biju Raju with myself. Smartphone apps for ophthalmologists. There are so many apps. So I'm not going to go into detail of all the apps, but I'll tell you the main thing which you need is the eye handbook. The eye handbook is very useful because it has many useful tests. Rest of it, it will have some extra tests, but this is the most useful one right now. If you want to see, this is the eye handbook tests which are available: acuity, contrast sensitivity, color vision, and so on. And all these are there in the app, so I'm just going to skip through it quickly. You can also record many things by using the smartphone camera itself. Smartphone refraction is there by iNetra, which is an MIT Media Labs startup by an Indian. This is eye handbook. Eye handbook also has optokinetic nystagmus, drum, pediatric fixation targets, which are very useful. So many calculators, IOL calculators, toric IOL calculators, surgically induced astigmatism calculator, visual acuity converter, so Snellen feet to Snellen meters, logmar, and so on. And of course transpositions. I use transpositions also on the app. And of course the glaucoma risk calculator, glaucoma CCT calculator, and Farnsworth-Munsell 100 hue test. That is available. Okay, the Farnsworth-Munsell 15 hue test is available in this particular app. You can arrange this and then calculate the score. Farnsworth-Munsell 100 hue test was there on another app which is not there right now. Park's 3-step test. If you find it difficult to remember the simple 3 steps, this app will help you to go step by step. Then there is this thing called Stereo Tab again for stereopsis testing with the red-blue glasses. And also if you just have a Google Cardboard headset, you can use the Stereo Acuity Google Cardboard test. Visual Fields on the iPad. This app was there called Visual Fields Easy. This was the basis for the MRF, the Melbourne Rapid Fields test, which is commercially available now. So this is the same thing, the initial part of it. This is the free version of it basically. OCT, if you have the OCT files, you can browse it on your iPad. You have to copy the files over and just go through all the slices. If you just want to take a photo, doesn't matter. But if you want to go through all the slices, this will go through the data and show it. And medication compliance, my eye drops app and so many other apps helps the patient to remember the eye drops. IOL vision simulator. From abroad, you can show the patient this is what vision will be with the multifocal, this is what will be with the monofocal. Learning apps, so many are there. 3D human eye. This is the iGrader app. iGrader app is for postgraduate students to remember all the grading systems, and also for other ophthalmologists who want to do research or document their things properly, to go through all the grading systems quickly. Language helper apps you already saw. Apps for low vision patients. This is something which is very often overlooked. Sometimes patients are there for whom you cannot do anything. So you tell them, this is what you can do. You don't tell nothing can be done for you. You tell them, this is what can be done for you. You can use these apps which will help your life become easier. Okay, these are apps which will help them navigate their reading, their life, counting money, and so many options are there in this. Okay, this is just a list of apps if you want to take a photo. And last, just quick word about the Jaundas foldable fundoscope, which Dr. Shisher has already covered. So I have a patent pending on it. And how did I design it? Using 3D printing. So I used a free software, of course, FreeCAD, and you can just make all these boxes, and cut it out, put circles, cylinders, and cut it out. Very simple, simple to learn. Go on YouTube and search how to do FreeCAD 3D designing. You can do this. Once you do this, you can go to a 3D printing shop and print it. So this is what it looks like after it is printed. The other one was the design. And this is the final device. It's this is the first model. The later model I will show you. I don't have the picture of the later model. Okay, so the later model has inbuilt illumination and it has a magnetic docking. The phone attaches to it magnetically. It closes into an apple-like curved edges design and fits in your pocket more smoothly. So thank you.
Thank you, Dr. John. That was a wonderful presentation. So, an app for everything, and also right from the beginning of history taking, examination, and right till the end posterior segment imaging, and much more he has shown you. So it all comes almost